Hi Bob, my name is Destiny. I'm here to collect some labs for you today. The doctor just wants to check your electrolytes and see if your levels are getting back to normal, and if not, then he wants to figure something else out to help you get better. Do you have any allergies that you're aware of? He tells me no, and that matches my chart. Can you please state your name and date of birth? Alright, and that matches my chart as well. Have you had this done before? He tells me yes. Alright, so I have to flush my first one and waste that, and then I will collect the sample. Some agencies require heparin flush, where you would then flush with heparin and waste that first one, but our agency does not. And sometimes if there is a cap on the end, then you do not need to swab with alcohol swab because it is considered sterile, but in our case we will be because these do not have caps. Alrighty, so all of my syringes are prepped and they all expire in 2030, so we are good. I got my little vital access and then my piece of tape to label afterwards. Alright, so I'm gonna put on my gloves. Have you been experiencing any pain or anything in your incision site? He tells me no. And I look at it and it looks good. There's no redness, no swelling, no drainage, so it doesn't look like there's any signs of infection or infiltration. Alrighty. So if it is a multiple lumen, you want to use the proximal one. You want to wash for 15 to 30 seconds. And then I'm going to attach my flush. I need to unclamp. Things are going in smoothly. There's no resistance. Alright, now I want to make sure to pull back 10 mLs. I'm going to make sure to clamp. Then I would dispose of this properly, whatever the policy is for your facility. Alrighty, so now I'm going to open up my bag container. So that's ready. There. Cleanse again. Now, if there were any medications running, you would want to stop them prior, unless they were like life-sustaining and you cannot, or if there is any TPN running, you would want to avoid that if you can. Alrighty, now our order is only for 6 milliliters. So you want to make sure you only take what you need and not extra. Making sure to clamp when I'm done. And then I'm going to place the cap back on. If I would have set that down, then it would not have been sterile. Alrighty, so now I simply just attach this. And then push in with a little pressure. And then just fills up on its own. Alrighty. I want to dispose of this in the sharps because it does have a needle on in there. And then I would want to put on my label that has the date, the time, my initials, and also the patient's info. And I can compare that and have him state his name and date of birth. Also check his wristband and see that it all matches. And I just turn it to make sure no coagulation occurs. And I would want to dispose of it, or not dispose, but place this in a biohazard bag and make sure to get it to lab as quick as they need it, because sometimes there is a time limit on that. Alright, and then I do use 2 flushes here at the end. And because it is a pick, I want to make sure to pulse. How are you doing, Bob? Is everything okay? And he says, yep, he's doing good. Clamp that again. Cleanse this one last time. And then our last flush. I would want to dispose of all my supplies. Like I said, making sure to get this down to lab right away. I would want to then document the time, the date, how much blood I took, which was 6 milliliters. There was no signs of infiltration or infection when I started. Bob tolerated well. He said there was no complaints of any pain or anything.